Dús bara bumálum an deise hapu ag siomacéad uair a caint sa Dáil, mo bhuíchas a gáil as pobl cún baile á clia a chur an seo mé. O broi mé crua mar glór son na fearna agus ceartís sóisialta. Bumálum freisin a rá cean an phobal bhuíchas ó chuí a gáil as Tommy Bruin, cá sé na blianta fada ag trid son leis an phobal. I want to begin just by saying that I commend all the healthcare staff, everyone in the HSE, all the public health officials for the work that they are doing, and our frontline staff. In times of a crisis, it's often those who are marginalised and those who are vulnerable who bear the brunt of the impact. And without swift action in this instance, that's what's going to happen. We need action to protect people who are homeless, people who are living in overcrowded housing, people who are in precarious work, as well as people with underlying health conditions, so that they are not hit hardest. Workers with temporary contracts, near 0 hours, and working in the services industries are at a particular risk. They're already at the risk where they're going to be facing, because of the changes in demand and changes in the services industry in terms of immediate demand, they're already going to be facing a situation where they're going to be on reduced hours and losing income before any immediate threat might rise to them. And I was at a launch yesterday by Task of research they've done on household indebtedness, and one of the findings from that research was that those who are renting privately are 4 times more likely than homeowners to be faced with a decision of not being able to afford to heat their homes. So when you're looking at low-paid workers and people on low incomes, they're already at a situation, many of them, where they're struggling to make ends meet. So any reduction in income is going to put them in an impossible situation, and they cannot be left in a situation then where they are going to be potentially out of work. They're going to have their hours reduced. They're going to have to self-isolate, that they're not going to have their income protected. So I think it's incredibly important that we move as quickly as possible to guarantee income protection, especially for low-paid workers. People are in a different situation in more permanent working conditions. That's not just important for people on low pay, it's also important for wider society. There's a health consequence of that. Research in the United States has found that the states where they've brought in mandatory sick pay conditions, that flu risk decreases by 11% in the first year. So if you don't create the conditions where people on low pay can actually take the responsible action that they want to take in terms of protecting their own health and the health of their families, it has a wider health and societal impact. So I think that's a vital move that needs to happen fast. In terms of the healthcare system and our undercapacity in intensive care beds, where we've half the level of capacity compared to the European average, it is welcome that steps are being taken now to try and increase that capacity. But I think we need to do everything we can in terms of capacity in private healthcare to supplement the capacity that's available in the public healthcare system. In terms of people living in overcrowded accommodation, and we all know in our own constituencies, it can be regular to have 3 generations in one house. It can be regular to have an entire family sharing the one bedroom. They're going to be in a more vulnerable situation as well, and we need to be looking at what extra measures can be put in place for people living in emergency accommodation, direct provision, and homeless people to support them. In conclusion, Cian O'Callaghan, we need to act now to protect workers on low pay who are 0-hour contracts, in temporary contracts, and people working in the so-called gig economy. And we need to act now to co-opt what extra capacity we can in the private healthcare system that is going to be that we are going to need to draw on. Cian O'Callaghan.